Hi, I'm Dr. Cameo Carter. Thank you for joining me again at the end of the day. I'm a full-time pediatrician and mom of three. And at the end of the day, I think about the patients that I've seen or things that have been in the news or things that we're dealing with, the things that are coming to mind, and kind of go through them with you at the end of my day. And I'm recording this in the fall. Cold and flu season is just starting. We actually haven't seen too much. I haven't seen any flu cases yet. Definitely seen a lot more colds coming and a lot more upper respiratory infections. And so we usually see that starting up before influenza season really hits. But with the start of that season, we see a lot more fevers, a lot more infectious disease. And so today I wanted to talk more about fevers because it seems like parents have this wide view of fevers and the function of fevers and how they treat fevers. And so wanted to go over a little bit of some principles about it. So I think the first thing I wanted to point out is that fevers are not necessarily good nor bad. They're mostly just a signal telling us that something's going on with the body in terms of infection or inflammation. And so they give us good information. But one thing I hear a lot from parents is some say, that they try not to treat the fever because the fever is helping the body. And that isn't necessarily the case. It isn't that if we let a child have a fever, that's going to help burn up the virus or the bacteria more. It is actually a byproduct, in that case, of an infection, but we're not doing them a favor per se if we just let that fever be. And on the converse side, it's also not harmful in most cases, unless the fever gets really quite high, to let your child have a fever. What is most concerning about a fever in most cases is the way it makes a kid feel, the fact that they're going to lose a lot more fluids when they have a higher temperature, so they have a higher chance of getting dehydrated. So treating the suffering, treating the discomfort is the most important part about having a fever. Now, true, when you have very high fevers or sustained high fevers, that can be harmful. But lower temperatures or temperatures who just run in the 102 region, mostly they're going to feel really miserable if they have a fever around that temperature. And so in general, you're going to want to treat that so that they feel a little bit better, so they're going to drink more, so that they're going to stay hydrated. Now, whenever I'm doing podcasts or social media, I always want to emphasize that for specific questions or concerns, always talk to your pediatrician and ask them. These are just general guidelines, but pointing out that it's not the fever isn't there to help kill the virus, I think is useful, because there's a lot of people who think that that's somehow better for the child, and that just isn't the case. I also find that parents, I don't know if you think, maybe you have to answer me about this, if you think that maybe I don't believe you or something, or they think that they need to let their kids have an elevated temperature coming into the office. So they'll say oh, we didn't give any Tylenol or we didn't give any Motrin because we wanted you to see their fever. And, most of us doctors, we believe you. You can tell us what the temperature was, and we absolutely will believe what that is. We will ask you often what was the method of measurement, because there can be some variability. If you use the temporal artery scanner versus an otic, and so it's kind of useful for us to know how you measured it, but you don't have to let your child have a fever. If they're not feeling well, you can mark down what that temperature was and give them Tylenol or Motrin, and and help them feel a little bit better. So it's not necessary for us to see it to believe you. Um, it is really important that a child stays very well hydrated. Like I mentioned before, having a temperature is going to make it so that they lose even more fluids. And so keeping them hydrated is one of the most important things when they have a fever. Appetite will be down, and we aren't as concerned if they're not eating, but drinking is really important. So we do really encourage that. And remember, there's other things that you can do besides Tylenol and Motrin. Both of those are fine to use. We don't use ibuprofen or Motrin until after 6 months of age. You can use acetaminophen and younger than that, but you can also do cooling measures. So room temperature bath is very effective, and it brings the temperature down really nicely, and so that can be a good supportive measure. And also putting lighter clothing. A lot of parents I've seen, when the child is chilled, will bundle them, put blankets and things on them. And in doing so, that actually increases their core even further. So really avoid doing that, even if they're kind of shivering, and instead bring down the temperature with cooling measures like a room temperature bath or with an antipyretic. That's the general name for the medicines like Tylenol and Motrin. Most fevers are occurring because they're having a virus, and it can be bacterial infections as well, but viral infections are a little bit more common. And most of the time those fevers are lasting for like 3 or 4 days. If you have a fever that's lasting longer than that, it is a really good idea to go see your pediatrician and see what else might be going on. And if there's any pain or any breathing issues at any time, make sure you're asking your pediatrician about that. You don't have to give a certain duration or weight of length of time before you see them. And in any cases, if you're worried, if you're concerned, if you feel like your child is acting a little bit off, we would rather see them and give you guidance and instructions and talk about next steps, even if it's something that means that we're just going to wait it out a little bit longer, than to have you really worried and not knowing what next to do. So to keep on hand, getting ready for the cold and flu season, do keep Tylenol and Motrin available. Make sure you have different methods of hydration or different things that, depending on your kid's age, that you may want to give them. And always reach out to your pediatrician if you have any concerns.